Welcome to this session presented by Mrs. Prudence Hamilton. Reporting is part of communication, and communication is a cornerstone in midwifery practice. That helps in giving essential information to nursing and midwifery profession. So as we are going to be looking at reporting in midwifery, it is one of the essential parts for us to know. So reporting can be done either orally or written in most cases. So it helps to give important information about the patient's status to the other team members in most cases. Reporting refers to the oral or written communication of information about the patient's health status, including their conditions, needs, treatment plans, outcome, and response. So as we have seen, it is either written or orally given and gives us what the patient's status looks like. In midwifery, reporting encompasses both oral and written communication of patient information to ensure continuity of care, legal compliances, and effective team collaboration. So the reason as to why we do report is to give us communication on how we are supposed to ensure care is continued to the patients or to the mothers that we are having, on some legal compliances, and also to have effective collaboration among health workers. Reporting includes change of shift report, incident report, telephone report, transfer report. It also includes documenting observations and interventions in the patient's chart. So as you're looking at reporting, as we have seen also, that is not only about verbal communication. You need to write. That means you are also going to include recording, or what we call documenting, as part of your reporting. So let's look at the different types of reporting. One is change of shift report. So change of shift report is mostly done orally by providing incoming midwife with information about the patient's current status, treatment plans, and any changes in the or constant in the treatment. So this is the most common report that is given most times by midwives and nurses. So you can do it orally by going to, let's say we are in the wards, you can report orally on each and every client. This one is done by the bedside. That means you move from individual clients or individual mother to individual mother to report their current status. Then we also have transfer report. Transfer report is when patient is moved to another unit or facility. So this report has details of condition, treatment, and special needs. So when you look at transfer report, is the one that we usually receive. Let's say the patient is moved from, maybe there was other issues that came in and it required, or let's say for example a mother came at around 30 weeks and they brought her to maternity. Maybe somebody admitted there, then you need to make a report to transfer this patient to go to gyna. So that is, we are making a transfer report from maternity unit to gynecological unit, or maybe ward. Or we can do, it can also be when we are transferring a patient from one facility to another one, especially during referrals. So this is what we call transfer report. We have incident reports. So incident report, these are written report documents of unexpected events or incidents. such as false medical errors, adverse reactions for investigations and improvement. So, for example, we can talk of, let's say, medical error. Maybe there was a newborn that was brought in as a referral, and then maybe you gave some medication and the newborn died on spot, or after you have given the medication. That is what we call incident report. Something which was unexpected happened, then you document. So you document it because it helps on further investigation and improvements. So our next type of report is telephone reports. So telephone reports are mostly used if they're urgency or in emergencies. Let me see. These reports are used to convey urgent and time-sensitive patient information to physicians or obstetricians or other healthcare providers. Let's say we have an emergency and the physician or the obstetrician is not within. So you can give report on phone to that person to know that there is an emergency. If they are able to come, they should come as fast as possible. Then we have patient case reports. So these are in-depth reports that focus on care of specific patient with particular diagnosis or condition. So the patient case reports are those reports which are given in detailed reports which are written to make sure that they are based on specific diagnosis of the patient and and the condition of the patient, including the care that has been provided already. So those are the 5 types of reporting that we do in midwifery and nursing. They're all the same. So we need to know the importance of reporting and recording. Reporting and recording are crucial aspects of midwifery practice as they ensure accurate and comprehensive documentation of patient care. So as you're reporting, you're giving comprehensive documentation, accurate and comprehensive information about what you have already done on that person. Proper reporting and recording facilitate effective communication, continuity of care, legal documentation, quality improvement in midwifery service. So the reason as to why you are supposed to report either orally or in terms of written is because it helps to promote effective communication. Sometimes you might have all what you have done documented, but still it's expected that you report orally also to your colleague to improve the type of communication you have with your colleagues. It enhances continuity of care. It acts as a form of legal documentation. In case of any errors or in case of any legal issues or cases, there would be evidence of what you have done. So we have elements of effective reporting, one of which is clear and concise documentation. So as you are reporting, it should be clear and concise. We don't need stories. So ensure that the information recorded is clear, concise, and easily understandable. Remember, in our reporting, it can either be written or documented. So if you are documented, it should be clear, concise, and easy to understand. If you are speaking it verbally also, it should be clear and concise. So use standardized terminologies and abbreviations to maintain consistency and avoid confusion. Don't come with your abbreviations that we have never seen before during midwifery training or during our medical training. So whatever abbreviation that you're going to use, it should be understandable to your other colleagues 2 is timeliness. Report and document in a timely manner to capture accurate and up-to-date information. Some people will just that have administered a test net 240 milligrams, or you have administered whatever and you have not put the time. How will the next person know that this is the next time I'm supposed to administer the next drug? So whatever you report, you capture the time that you have done something. So prompt reporting helps in maintaining continuity of care, facilitate collaboration with other healthcare professionals. 3 is accuracy and objectivity. So reporting helps us to be accurate and objective. Provide accurate and objective descriptions of events, assessments, interventions, and outcomes. So by reporting, we are able to be accurate or to provide accurate information following the objectives or following plan of care. Avoid personal opinions or bias and focus on factual information. Like I said, don't give us stories. Go straight to the point. 4, relevant information. As you're reporting, you should give important, relevant informations. Include essential details related to the patient's condition, interventions provided, response to treatment, and significant changes which should be observed. So if you know that you have given some medication already, you should tell the next person that I've already given this, maybe try to observe these changes, or maybe the drug that I've given, the person has already started responding, or the person reacted. All those responses you need to give. So report relevant contextual information that may impact patients' care or decision making. So that is that. With reporting, in most cases, we intend to give what we call concise and precise report. Something which is concise and precise, you capture all the most relevant, important information that will be able to make sure the next person is able to provide care to the same person you have been handling. So thank you so much for attending this short session of reporting in midwifery. See you again in our next lecture.